Good afternoon. I'd like to welcome everybody to our seminar series to celebrate the opening of Medical Park 2. Today I'm going to be talking to you about hernias. So you have a hernia, what's next? My name is Ron Lewis. I'm a general surgeon. I am co-director of the Hernia Center of Excellence at the Northeast Georgia Medical Center. I joined Northeast Georgia Medical Center in 2001. I've done a little bit over 2,000 minimally invasive hernia cases in my career and over 500 robotic hernia cases over the past 4 to 5 years since training on the Da Vinci system in 2015. The Hernia Center of Excellence is located at Northeast Georgia Medical Center in Gainesville, Georgia. We're about 557 beds. We have 23 operating rooms, and currently we have 4 Da Vinci robotic systems that help us do hernia repairs. I guess it would be good to know exactly what a hernia is. A hernia is just a defect in the abdominal wall that allows things that are normally on the inside to come to the outside. And the treatment is surgical. I wish I had a magic pill or a magic wand that would make these go away, but it does require surgery to fix. It's a very common problem. There are around 1 million hernia repairs done in the United States per year. About a little bit over 2/3 of those are going to be the groin hernias that people talk about, inguinal hernias, femoral hernias that are more common in women. And then the rest of them are considered to be ventral hernias. Ventral hernias would be things like an umbilical hernia or an epigastric hernia. And then, of course, incisional hernias are part of that makeup as well. And these are some of the locations that we just talked about. The ventral hernias being the epigastric and the umbilical, and then, of course, the groin hernias being the femoral and inguinal. Why do we even bother with hernias? Well, certainly symptomatic hernias we do like to repair, but we also like to repair hernias to avoid things like strangulation and incarceration. Incarceration just means that whatever is poking out cannot be reduced back into its normal anatomic position with gentle pressure. And when that happens, you worry that it will choke off the blood supply and become strangulated, and then whatever is poking out will actually die. And that turns a nice elective outpatient operation into an emergent operation and totally changes the character of the operation. Certainly, there are different types of hernia repairs. There's the open hernia repair, there's a laparoscopic or minimally invasive, and then a robotic, which is also minimally invasive. Our focus is certainly on minimally invasive techniques here at the Hernia Center of Excellence. We think that that causes much less postoperative pain, a decreased length of stay. As a matter of fact, most of these hernia operations are done on an outpatient basis where you come in on the same day. We do the operation, you hang around for several hours in recovery, and then you go home. It also offers, in our opinion, a very much improved or quicker return to normal activities. Normal activities could be as simple as gardening out in the backyard, or it may be a return to work. And of course, one of the components of this minimally invasive repair is the Da Vinci robot. Some subtle differences between the laparoscopic and robotic approach would be the 3D visualization that we get with the robot. Instead of the instruments being what we call straight sticks, they actually are wristed instruments to where we can move around in different planes. And the robot really excels at what I like to term unexpected complexity. When you are thinking you're going to be able to do one operation and you've got to transition and do a different type of operation, the robot is very good at handling that. Why do you need your hernia repaired in a Hernia Center of Excellence? In my opinion, there are multiple reasons to do so. Number one is the experience of the Hernia Center. Certainly, you want to go to somebody who has been educated and trained to do hernia repairs and has the experience of doing hundreds, if not thousands, of those repairs. Quality, you want to make sure that you go to a high quality center where we monitor things like our recurrence rate and our infection rate to make sure that we are better than the national average. You want to go to a center that offers comprehensive hernia care. When I say comprehensive, I mean not every hernia can be repaired on the robot. And so you need somebody that can do that open procedure if that's the type of hernia repair that you need. And then we talk about evidence-based care. That's part of our quality metrics. We do participate in the America's Hernia Society Quality Collaborative. That is a HIPAA-protected database that we put patient information and operative information into, and it helps us keep track of our recurrence rate and our infection rate, and really to maximize that quality and value for the patient. I'm going to wrap up here, and of course, if there are any questions towards the end of the presentation, please feel free to put them in the chat room or to message them, and we'll see about getting those answered. But just to wrap up, just some external pictures of pre and post-operative. Left-hand side of the screen is the pre-operative. This is an umbilical hernia. We typically would consider this to be a simple type of hernia, but repaired on the robot, you can see that immediately post-operatively in the right-hand picture, we've already been able to recreate that umbilical stalk. And this is a great long-term durable repair that we like to provide using the robotic system. And then something a little bit more complex for you. Left-hand side of the screen is a very complex incisional hernia. The right-hand side is that about 2 weeks post-operative, and you can see the marked difference in the pre and post-operative appearance of that hernia. So yeah, bottom line, you have a hernia, what's next? We'd love for you to be evaluated in our hernia center. We do think that most hernias should be evaluated by a hernia expert or somebody experienced or a specialist in hernia care. Certainly symptomatic hernias need to be repaired, but there are some asymptomatic hernias that we recommend be repaired as well, and you really need to talk to an expert about how to differentiate between those. You do have a choice. We have a phone number that's set up that you can make appointments through. We also have a website, that's nghs.com/hernia, and that has a fillable form that you can submit for a hernia appointment as well. And that's about all I have, unless we have some questions out there. If there's anything I can answer.
Okay, Dr. Lewis, do you have...
So the question was, does the patient have to have a referral? We certainly can help you navigate that if you make contact with us. That mostly will depend upon the insurance plan that you have. And some insurance plans do require the primary care physician to be engaged, but we can help you navigate that.
Okay, we have another question from the audience. Are surgeries going forward during this pandemic?
Yes. So the question was, are surgeries moving forward during this pandemic? The answer to that question is yes. It is advantageous that most of our hernias can be done on an outpatient basis. In our system, as of today, we are testing everybody for the COVID-19 virus preoperatively, and negative patients are kept separate from those inpatients that may be positive. So it's almost like we have a two-track system. The outpatient COVID negative kind of run through this particular area of the hospital, whereas the inpatient is done separately. So yes, we are proceeding and operating almost back to a full schedule, even in the face of the pandemic.
Okay, what are some of the safety precautions that you guys are taking in the office right now as related to coronavirus?
So great question. What are some of the safety precautions that we're utilizing in the office right now? We are all wearing masks in the office. My mask is sitting right over there. We are both patients as well as staff. We are, of course, cleaning and letting the rooms air out in between patients. We are also limiting visitors within our practice. Certainly, if there's a patient that needs a visitor for some reason, such as the patient requires some additional assistance, then we will allow visitors come in. But we're asking for patience and understanding by letting visitors stay outside and not progress through the office. So we're doing everything we can to try to make it as safe as an experience as we possibly can.
Okay, I don't think that we have any other questions unless anyone else has something to submit. We'll give you guys just a few more minutes before we wrap up. Okay, I think that looks like it for today. We can put back up the phone number on the screen. And if you do have any questions, you can reach back out at the end of this and we will make sure Dr. Lewis gets those.
All right, thank you very much. We're very excited to be in the new Medical Park 2 building and we look forward to seeing you.